no longer prioritizes corruption fight. Northern elders advise President Buhari to show exemplary leadership. New service chiefs not enough. In international news, European Union hit hard by vaccine shortage caused by delivery delays. And in sport, Edo State Governor Obaseki says no funds to host National Sports Festival.
This is ANN News.
I am Olajumoke Olatunji. 22 more persons have died in the country as a result of COVID-19 complications, bringing the total number of casualties to 1,544. The Nigeria Center for Disease Control, NCDC, reported on Wednesday 1,861 new cases of COVID-19 had been recorded in 21 states and the Federal Capital Territory during the same 24-hour period. Of the new cases, Lagos embraced the highest number of 773. 285 Abuja confirmed 285 cases, while Oyo reported 138. Rivers chopped 111. Plateau, Nasarawa, Kaduna, Enugu, Imo, Edo, Kano, Kwara all recorded cases in high double digits. Ebonyi, Abia State, Ogun, Osun, Katsina reported new infections in tens. The rest of the 5 states posted cases in single digits. NCDC said the numbers of recoveries and discharged on Wednesday increased by 1,089. American philanthropist Bill Gates has advised the Nigerian government against diverting its limited health funds into payments for COVID-19 vaccines. Gates gave the advice during a virtual press conference ahead of the launch of the 2021 Bill and Melinda Gates annual letters. He said the federal government needs to wait for the Gavi vaccines. He said investing proposed vaccine funds in other health-related areas would assist to deepen vaccine coverage and save lives. Gavi is a global vaccine alliance that brings together public and private sectors, creating equal access to new and underused vaccines for children living in the world's poorest countries. Gavi is co-leading COVAX, whose aim is to accelerate the development and manufacture of COVID-19 vaccines and to guarantee fair and equitable access for every country in the world. Executive Director, National Primary Healthcare Development Agency, Fausa Shuab, had said Nigeria aimed to vaccinate 70% of its population to stop transmission of COVID-19. Shuaib said about 40% of the population would be vaccinated against COVID-19 in 2021, the remaining 30% before the end of next year. Minister of Health, Dr. Sage Hanire, had put the federal government's funding needs at about 400 billion naira to vaccinate 70% of Nigeria's 211 million population. Nobel laureate Professor Wale Soyinka says Nigeria's judiciary has been manipulated by the country's powerful persons because President Muhammadu Buhari's administration has gone back on its word to end corruption. Soyinka said the system had become corrupted so badly that court cases were being stretched out through technicalities. He says there are so many persons who should be in prison if this government had not run out of steam. The professor also urged the National Assembly to listen to calls for the restructuring of the country and take responsibility towards that goal. Such regional groups as the Yoruba Socio-Political Organization, Afenifere, its counterparts in Ohanes Ndibo, the Pan-Niger Delta Forum, PANDEF, and the Middle Belt Forum have been loud in the call for the nation's restructuring. The Northern Elders Forum says President Muhammadu Buhari needs to show exemplary leadership enough to bring desired changes in all regions, especially in the war against insurgency and all other security challenges ravaging the country. The forum says the president has to change his attitudes to the defense and security of the country. The group says it is worrisome that as dangerous as Nigeria's highways are and increased security flaw, the president's spokesperson still maintains the situation is better than it was in 2015. NEF spokesman Dr. Hakim Baba Ahmed says, quote, "There are no suicide bombings now, but the population of Nigerians living under Boko Haram is large, huge, and unacceptable." Baba Ahmed says the situation has gone beyond new appointments of service chiefs, but now needs a more drastic and intentional approach. Nothing Elders says replacement of the service chiefs might not be effective if the president leads the new crop of service chiefs the same way he led the former commanders. Baba Ahmed also said Nigerians would know if the president made the right choices in his appointment of the new service chiefs in the next 7 months. Kwara State's Governor Abdulrazak has signed into law a bill cancelling payment of pensions to former governors of the state and their deputies. Abdulrazak, who had earlier announced his plans to repeal the law, said Kwara State can no longer afford the payment of pensions to former leaders. The beneficiaries of the voided pensions of former governors Bukola Saraki, Abdul Fattah Ahmed, and their deputies, who each served 2 terms between 2003 and 2019. The pension law was passed in 2011 under Saraki's administration. Abdulrazak signed the act repealing the pension law during a brief budget signing ceremony attended by the Speaker, Yakubu Danladi Saliu, and some members of the State House of Assembly. A federal high court in Abuja has ordered the final forfeiture of about 700 million naira linked to former Zamfara State Governor Abdulaziz Abubakar Yari. The Independent Corrupt Practices and Other Related Offences Commission, ICPC, reviewed Yari kept the funds in accounts in banks using his 2 companies, Kayatawa Nigeria Limited and BT Oil and Gas Nigeria Limited. Justice Ijeoma Ojukwu held that Yari could not prove how he got the funds while or before serving as governor of Zamfara State between May the 29th, 2011 and May the 29th, 2019. He queried how one of the company's bank accounts grew from zero to more than $300,000 at the end of his tenure. Yari had claimed that the action of the ICPC was a political witch hunt, but Justice Ojukwu disagrees. Coming up, African stories. Senegal eager to receive first COVID-19 vaccine doses to avert coronavirus second wave catastrophe. And later, international news. European Union hit hard by vaccine shortage caused by delivery delays.
You are watching AN.
Welcome back. This is ANN News. Just like any other African nation, Senegal is looking forward to receiving its first COVID-19 vaccine doses, but not until March. Now that the second wave of the virus is flogging many countries, Senegal is working to avert COVID-19 catastrophe.
A second wave of COVID-19 infections in Senegal. Health authorities in the country say a vaccination exercise will begin before end of March. Priority, though, will be given to persons over 60 years old, among other vulnerable populations.
The trials we have done are to see if there are any side effects. This has not been detected in the COVID-19 vaccines we currently have. Since the beginning of the pandemic, people have been trying to find the weapons to fight the disease effectively, but have not found them. But today we have all realized that the most lethal weapon to eradicate this pandemic is vaccination. It is important to know that the benefit far outweighs the risk, so I'm asking all Senegalese to agree to be vaccinated.
manifestations allergiques.
Side effects of the COVID-19 vaccines, according to health officials, are not severe and only last 24 hours. However, health authorities are facing the challenge of convincing members of its populace who are reluctant to be vaccinated. Professor Dieye explains the different phases of vaccine trials.
Before, people used to do a phase 1 trial and it took a year. Now people combine phase 1 and 2 because it's the same thing. Phase 1 is a limited number of doses working on the safety of the vaccine so that it doesn't cause a problem for the population, that it doesn't kill. Phase 2 is similar to phase 1 but with a higher number of doses. It also makes it possible to vary the doses. Phase 3 is the efficacy phase, which has been combined with phase 2. It consists of putting together a group of people who are not receiving vaccines as opposed to a group that is receiving the vaccine. And if in the group that has been vaccinated, the number of contaminated people is very low, this allows us to have a good estimate of the vaccine's effectiveness at 95% or more.
Senegal currently has over 24,000 cases of COVID-19. To tame further spread, President Macky Sall has reimposed a state of emergency. The restrictions prohibit public gathering, impose wearing of masks, and reintroduction of a curfew system.
Tunisia is making plans to begin inoculating its population by April. Algeria said earlier this month it would share its vaccine doses with Tunisia in the spirit of fraternity between the two countries. Algeria has ordered batches of the coronavirus vaccine from its long-standing allies, China and Russia. First batch of Sputnik V is expected to arrive at the end of this month. Correspondent Adnin Chawoji has the details.
Health Minister Fawzi Mahdi said his departments seek to vaccinate 50% of the Tunisian population this year. Health authorities have mobilized 200 vaccination teams.
The vaccine will protect Tunisians and reduce the number of victims and dangerous cases which require intensive care beds and put pressure on hospitals. The vaccine will allow for gradual return to normal life so that the state can manage the negative health, mental, social and economic repercussions on the population.
The remote COVID-19 vaccine registration system EVAX is operational. An app is available on mobile devices or on the website evax.tn. The vaccination registration platform is similar to the one designed for elections.
This system was built in record time, not exceeding 3 weeks. It involved several departments and ministries. Technology is at the service of science and medicine. Our engineers are ready to help in the fight against COVID-19 by organizing the vaccine rollout and a large-scale vaccination operation.
Some 100,000 citizens across the country have already registered on the platform. So far, nearly 80,000 citizens have registered via SMS and 20,000 through the internet.
I have registered because I trust the state and the Ministry of Health. I encourage elderly people to register on the platform so as to benefit from the optional vaccination against the coronavirus.
Tunisia will receive over 6 million shots of the vaccine in April. 2 million doses will be procured directly from manufacturers and 4 million from the global COVAX initiative. According to the COVID-19 task force, the death toll has surpassed 6,300 since the outbreak of the pandemic in the country. Vaccinated citizens will receive follow-ups on their health status through the digital platform and a call center.
Moroccan authorities began distributing COVID-19 vaccine doses in Casablanca on Monday, ahead of a nationwide launch of a vaccination operation. The country received the first batch of AstraZeneca's vaccine doses on Friday. It also took delivery of the first consignment of China's Sinopharm vaccine doses on Wednesday. Morocco has acquired 66 million vaccine doses that would cover its population of 33 million at 2 doses per citizen. When we return, international news. European Union hit hard by vaccine shortage caused by delivery delays. And later, sport. Edo State Governor Obaseki says no funds to host National Sports Festival.
You are watching ANN. Somewhere in the world, every second of the day, news is happening. And of course, Nigeria is bustling with news day and night. That is why ANN doesn't sleep. Our eyes are peeled, wide open, so no story escapes our radar. We stay abreast of world events and happenings at home. We keep you up to the minute in the world of sports. We give you information to stay on top of your investments and all the hard facts you'll need to navigate your day. If you miss us on air, you can keep up to date on our website and on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. We are ANN, Africa News Network. We do news right in a truly African spirit.
Welcome back. This is ANN News. Europe's coronavirus vaccination troubles worsened by midweek when Spain became the first country to partly suspend immunizations because it had no more vaccine doses. The exercise had been put on hold in Madrid for 2 weeks. Catalonia looks like it would be next. With all its money and influence, the European Union has found itself behind Britain and the United States, as well as other nations like Israel, Canada, and the United Arab Emirates in trying to secure enough doses for its people. And this places it in almost the same group as poorer nations that are also struggling to obtain any vaccine doses at all. AstraZeneca announced it would delay vaccine deliveries because of a production shortfall. The European Union has found itself begging the company to take supplies from British plants so EU countries can have some. Last week, the European Commission had set a goal of inoculating 70% of its population by summer. 4 days later, European Council President Charles Michel dismissed the plan as difficult. Meanwhile, Britain has vaccinated more than 10% of its population and has tightened its international travel restrictions. Citizens arriving from any of 22 high-risk countries are now required to quarantine in hotels for 10 days at their own expense. The coronavirus pandemic has begun to cause similar difficulties for many health systems. Over the past few weeks, there have been reports of medical oxygen shortages in many countries. Now, Mexico has joined the list. Oxygen tank shortages are suffocating Mexicans amid the COVID-19 pandemic. Correspondent Frank Contreras reports.
We've come to this oxygen tank refilling station in Mexico City. A police siren warns, alert, we are in a COVID-19 emergency. With the health crisis hitting record levels, people here urgently need oxygen. Hundreds come to this private company, Infra, one of a handful of places in the capital where they can refill tanks with life-saving oxygen.
Each of the people in this line here today all have a dramatic story about their family members who are suffering, people struggling to breathe. They're in line here to buy oxygen. The biggest problem they face is if they don't come with a tank, because at this moment, no tanks are available.
50-year-old Maria Luisa Cepeda has been waiting in line for 2 hours. Her brother Roberto, just 41, has COVID-19. He's at home struggling to breathe.
The most difficult thing is getting hold of a tank where it's portable or this size. It's very difficult in Mexico. Some people are taking advantage of the crisis and they resell their tanks at high prices.
She says large tanks are being sold for upwards of $6,000. The Mexican government is refilling about 120 oxygen tanks a day for free. But as the deaths mount and the tank shortage intensifies, many people here are gasping for their last breath.
A World Trade Organization says global services trade that has been catastrophically affected by the COVID-19 pandemic is not showing any sign of recovery. WTO statistics released on Tuesday show global services trade in the third quarter of 2020 fell by a quarter compared to the same period in 2019. This represents a small uptick from the 30% year-on-year decline registered in the second quarter, in marked contrast to the much stronger rebound in goods trade. The latest statistics confirm earlier expectations the services trade would be harder hit by the pandemic than goods trade, which was only down 5% year-on-year in the third quarter. Travel remains the most affected service sector, down 68% globally, compared with the same period of 2019. Trade in other services such as construction, recreational, legal and financial services repeated its uneven performance. Most subsectors contracted, with computer services a notable exception. Computer services remained the most dynamic sector in the third quarter, up 9% because of increasing global demand for cloud computing platforms and virtual workplaces. Up next, sport. Edo State Governor Godwin Obaseki says no funds to host National Sports Festival. Please stay with us.
You are watching ANN.
Whether in your house, at your office, on your phone or online, we are there. We have the facts behind the headlines. We cut to the chase with the news you really need. We cover every angle. We are the bigger, better news network. We are African News Network. ANN. Watch ANN News on MITV from a truly African spirit.
Welcome back. This is ANN News. Sport. Edo State Governor Godwin Obaseki says even though his administration is still willing to host the 20th National Sports Festival, there is presently no funds. The sports festival was called off 3 days to its commencement date in March last year because of COVID-19 outbreak. It was rescheduled to hold next month, but Governor Obaseki says the state cannot afford the expenses of hosting the festival. Inter Milan coach Antonio Conte has received a 2-match ban and a €20,000 fine on Tuesday for verbally threatening the referee after last weekend's Serie A stalemate. The Lega Serie A punished Conte for disrespectful phrases toward the referee that continued off the pitch. Former Juventus and Chelsea manager Conte allegedly confronted the referee in a threatening manner, screaming at him, a seriously offensive expression. Inter-team technical manager Gabriele Reale was also fined €5,000 and given a 1-match ban. Conte will miss their next 2 league games against Benevento and Fiorentina. That is ANN News this evening. Thank you for joining us. For details on these and other breaking stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I am Olajumoke Olatunji. Have a pleasant evening.